Nairobi and Mombasa counties continue to record the highest attack rate of COVID-19. The attack rate is actually the number of positives normalized to population, so that it is easy to compare between counties when you normalize it to population. So the attack rate is really the number of positive cases per 100,000 people. That attack rate is highest in Nairobi with 176.1. Mombasa, which at one point had the highest attack rate, is now second at 151.9 per 100,000 of the population. These are the two counties that are really the hardest hit, because when compared to all the other counties, the attack rate in all the other counties is about 28.1 per 100,000. As of yesterday, Nairobi had 7,744 cases, followed by Mombasa with 1,835. Then Kiambu, which borders Nairobi, is third with 769. Kajiado and Busia, being at the border points, have also recorded high numbers of 694 and 635 cases respectively. While Machakos, which shoulders a lot of cross-border trucks in Athi River, has 372 cases, and Migori, also at the border, comes in seventh with 215 cases. Those are the high number cases counties. Other counties are Nakuru 195, Uasin Gishu 166, Kilifi 95, Makueni 72, Kwale 56, Taita Taveta 43, Kisumu 41, Garissa 36, and so on. We go downwards in descending order until Elgeyo Marakwet that has one case. These details are in the report. You will be able to get that. Fellow Kenyans, turning to our COVID-19 situation in the country today, we have 418 people who have tested positive for the disease after testing a sample of 2,474 over the past 24 hours. This now brings to 13,771 our number of confirmed cases in the country, and the number of cumulative tests that we have performed so far stand at 246,361. These 418 confirmed cases, 408 of them are Kenyans, while 10 are foreigners. 263 are males, 155 are females, a pattern that we have seen repeatedly. Again, the youngest this time around is a 1-year-old infant. The oldest is 86. So, being infected does not respect age either. The 418 cases are distributed in the counties as follows: Nairobi 292, Kiambu 54, Machakos 28, Kajiado 13, Mombasa 6, Nakuru 5, Narok 5, Meru 5, Kitui 3, Nyandarua 2, Nyeri 2, Busia, Garissa, and Isiolo 1 each. In Nairobi, we have several sub-counties that have been affected. The 292 cases from Nairobi come from Starehe 31, Langata 27, Kibra 23, Westlands 21, Makadara 20, Roysambu 19, Embakasi East 18, Dagoretti North 17, Embakasi West 16, Dagoretti South 15, Embakasi South 15, Kasarani 14, Embakasi Central 13, Mathare 12, Embakasi North 11, Ruaraka 11, and Kamkunji 9. In Kiambu, the 54 cases are from 7 sub-counties, and I will not list them, but they are available on this document. In Machakos, 28 cases come from Machakos Town 17, Athi River 9, Kathiani and Matungulu 1 each. Kajiado has 13 cases, as I said earlier on. Mombasa, we picked only 6 cases this time around. Nakuru's 5 cases come from Nakuru East. And in Narok, the 5 cases are in Nakuru South. You will find in the document further information on the sub-counties that have been affected. Today, I'm delighted to inform you that 494 patients have been discharged. Out of this number, 465 are from the home-based care program, while 29 have been discharged from various hospitals, bringing the total number of recoveries to 5,616. And I want to take this opportunity once again to thank our healthcare workers for this great achievement that we have been witnessing. On a sad note, I think the 19 number is wrong. It's an error. It is 4 deaths that were recorded today. 4 deaths. So I will take back all that stuff about this being the highest number of deaths, so apology, but that is an error. Okay? And we will correct the document with those figures before we release it to you, so that you are able to communicate the right information to the public. Thank you.
Passing on from the home-based care management. So far, not yet, but we will continue monitoring this, because it's a way of monitoring the success of these home-based care protocols. Maybe to expand right side today on the issue of bars. That is an issue that is disheartening all of us. That the more cases we are reporting of COVID-19, the more we are seeing Kenyans taking to the bars, and some very late in the evenings. I thought the guidelines were very clear that bars remain closed. And in his address to the nation on 6th July, the President insisted that the bars are to remain closed. So what we are seeing opened are not bars, but those that we authorized to open as restaurants and eateries, that, as Waziri has said, have converted themselves into bars and serving beers up to 4 a.m. against curfew times. I do remember that in his directive, in his speech also, he directed that even these eateries, beer shall be served on a takeaway basis. So anyone who is serving a beer in a sitting arrangement is contravening the presidential directive. So only stern action can be taken against such. And the ministry, in conjunction with other relevant authorities, are working on this. And as the CS said, some may have to be closed, but not just closed. I think there's a legal notice in the process. And punitive action will be taken against it, not just closing the restaurants, because it is disheartening. And the behavior of some of them, if you walk across, is even more disheartening. The behavior in these bars at 1 a.m. is deplorable. All those things that you have talked about, social distancing and contact, are the very opposite people are doing. Masks are thrown off, and all manner of human behavior is back in the restaurants. It's deplorable. As I always say, Kenyans are Kenyans.